Tonight on Insight, pulling teeth.
Straight up my big back teeth, roots and all.
You took them out yourself?
Yeah, by hand, just bang.
I heard the crack and the pain, it just shot up. And it was indescribable, the pain. And I pulled this out.
You tend to do more extractions rather than trying to save the teeth.
No government has ever put total dental care on Medicare.
When I woke up, I was actually in intensive care because I had really bad infection and they had to put a drain in my neck through to the gum.
Teeth, and with dental costs rising faster than the CPI, some people are now finding it cheaper to get their teeth fixed overseas. Here's Anne Worthington.
But you can see there again, I'm not smiling.
When Graham Taylor got married, there was no way he'd flash the camera a smile.
Well, smiling, but certainly with a closed mouth.
Just me doing all the smiling.
Obviously very self-conscious about it even, but no smiling again. Well, you didn't marry me for my teeth, did you?
Last year, he found an article in the paper about Australians travelling abroad for cheaper dental work. He decided to look into it.
Look, I think, honestly, if you do your due diligence and you investigate as much as you can about the clinic, if at all possible, go and actually see the clinic for yourself. Don't just book a ticket and go over there and, you know, expect to get a great job done. I think if you do your homework, then I think the risk is obviously a lot less.
Good luck. See you, mate. A year later, and Graham is a seasoned traveller. So where does he go? Thailand, the country marketed as the land of smiles. Dental tourism is booming in Thailand, with dozens of clinics offering cheaper dental work to foreigners. This is the fourth time Graham has travelled to this Bangkok clinic for dental treatment.
Hi, Dr. Lily. How are you? Sawadika. How are you?
Nice to meet you again.
Nice to see you.
Okay, we're going to do a lot of work today.
The clinic is totally catered to travellers' tastes, and although not registered under her name, Dr. Lily is the front woman for the business.
So this is the...
She's been in trouble with Thai dental authorities for over-promotion. But Dr. Lily has no shortage of patience as she cashes in on the Western desire for perfect teeth. How many Australians have you treated?
It's about 1,000 Australians have been treated with our centre during the past 7 years.
Graham has been treated by several dentists in this clinic, and today he's having the final touches put in place. All up, he's spent $10,000.
So this is just a picture of how my teeth used to look, and you can see the incisors were very long. The front two teeth were chipped and quite uneven. There's a large gap there, and there's gaps here as well, and quite discoloured as well, so quite yellow and just very unattractive looking. And this was the teeth after the treatment.
Wow.
Which is really night and day. This is a bridge just in the centre, so they've had to widen the gap here and then put the bridge in, and then we've got veneers and crowns. All the gaps have been filled, and everything's been pared back and it's all been evened off. So now it's almost a perfect smile.
He's happy with his new smile, and he's smiling even harder about the savings.
I've probably saved, I would say about $30,000. With the work that I've had up to now, it probably would have cost me here about $35,000 to $40,000.
Well, Lisa, unfortunately, your husband Graham couldn't be here tonight, but I understand your 6-year-old son Campbell's having a few dental problems. Will you send him to Thailand as well?
Yeah, I probably would. I mean, he obviously had to have something done quite urgently. He had one tooth, a root canal done because he had a huge abscess in his cheek, so I obviously couldn't wait for that. But yeah, if I'd obviously have to check because he's got to have a general anaesthetic. So yeah, I'd be quite happy to send him over there as well.
And how did you find out about going away to get it done rather than getting it done here?
Well, we'd lived overseas for a while. We'd had lots of friends who'd gone over to Thailand for other things besides just dental, so we were quite open to the idea. And Graham's always pretty thorough and he does his research. So he's always wanted to have it done, and that way he could afford.